Hello, everyone. My name is Rebecca Golick, and I'm the Programs Director for the Minnesota HIMSS chapter. I am excited to welcome you all to our webinar event today on Healthcare Digital Transformation with Ed Marx. We will be recording this event and making this available for future viewing on the Minnesota HIMSS website. If you would like to be a speaker or sponsor for a future webinar event, please reach out to us via our webpage at mn.himschapter.org. We will be doing a Q&A throughout the session, so please feel free to type your questions in the questions section of GoToWebinar at any time. I am pleased to introduce our sponsor for this event, Tarek with Bahama Consulting. Tarek, thank you for joining us today and for sponsoring our webinar.
Thank you, Rebecca. I appreciate it. Hi, everyone. My name is Tarek Hudurovich. I am the Vice President of Sales and Strategy here at Bahama Consulting. We are very proud to be a HIMSS Gold sponsor. We have enjoyed our partnership with HIMSS over the years, all the valuable lessons and exposure we have gained through it, one of them being Ed Marx himself, and we look forward to many more years. A bit about Bahama Consulting. We are a woman-owned consulting and staffing organization located here in Eagan, Minnesota. Been around for 18 years now. Core strength and focus has been within the healthcare IT sector. We have partnered with so many cool, innovative, game-changing healthcare organizations across the entire country and worked on some very exciting cutting-edge technology. Obviously, this year has been very different for many of us, unfortunately negatively impacting a lot of different organizations. The space that we're in obviously is asking a lot from many of us today that are on the call. So I want to thank you all first and foremost for the service. I want to thank those that are in these healthcare systems and are on the forefront of fighting the pandemic and helping us overcome this. At Bahama, we have spent countless hours in an attempt to find a way to help support some of these organizations. Recently, we opened up an allied health division of our organization that has been focused on providing clinical staffing services to assist some of these healthcare systems in need. I'd be more than happy and honored to discuss this in further detail with any of you that are on the call today. With that said, our close partnership with HIMSS and the opportunity to work with some of these systems has led to a very wonderful relationship, which leads me to an introduction to our speaker today. I do have the great honor of introducing Mr. Marx. Edward Marx serves as the Chief Digital Officer for Tech Mahindra Health and Life Sciences. As the CDO, he oversees the digital strategy, the execution for providers, payors, pharma, and biotech as well. He's an active on boards, writing books, speaking globally as a partner in Marx Marx LLC. Edward was Chief Information Officer at Cleveland Clinic, an $11 billion health system with facilities in Florida, Nevada, Toronto, Abu Dhabi, and London. His responsibilities here included digital solutions and information technology as well. Prior to joining Cleveland Clinic, Edward served as the CIO for the advisory board, NYC Health and Hospital, Texas Health Resources, and University Hospitals. Concurrent with his healthcare career, he has served 15 years in the Army Reserve as a combat medic and a combat engineer officer. Thank you for your service. Edward is a fellow of the College of Healthcare Information Management Executives and Healthcare Information and Management System Society. As many of you know, he's won numerous awards, including HIMSS Chime 2013 CIO of the Year. He's been recognized by CIO and Computer World as one of the top 100 leaders. Becker's named Marx as the 2015 top healthcare IT executive and the 2016-17 most influential people in healthcare. He's an author of 5 books, including the 2019 healthcare bestseller, Voices of Innovation. His new book, Healthcare Digital Transformation, How Consumerism, Technology, and Pandemic Are Accelerating the Future, is already a 2020 bestseller, as many of you know. He's now contracted 2 additional leadership books in 2021. He received his Bachelor of Science in Psychology and a Master of Science in Design, Merchandising, and Consumer Sciences from Colorado State University. Ed is married to Simran. They have 5 children, 4 grandchildren. Both are wellness fanatics. They love to work out together and hike throughout the world. And they co-wrote a book on passion and marriage that is to be released in the fall, which is very exciting. Look out for that. He's a 7-year member of the Team USA Triathlon and represents his country at championship events around the world. It's my pleasure to introduce and share today with you. Ed, go right ahead.
Hey, thank you, Tariq. Yeah, that's sort of the long version of my history. I've got it down to like 2 sentences because it's kind of embarrassing, but I am really excited to be with you, and thank you, Bahama Consulting. I know the principals, the owner, fantastic people. So you're very blessed there in Minnesota to have them headquartered right there. And thank you, the HIMSS chapter. I love HIMSS, I really do. I started out in healthcare IT a little bit late compared to most people. So one of the things I got involved with was HIMSS right away. I got involved with the Colorado chapter of HIMSS, and I immediately volunteered to serve on their the events committee. And then so that was a great experience. Then when I left for Nashville, I got involved with the Nashville HIMSS, became the chapter president. Went to Ohio and became chapter president, took some national volunteer roles with HIMSS, and became a senior and fellow. So I just encourage everyone that's involved. One, great for you, good for you. It's great for your organization when you're involved. It's good for yourself in terms of your leadership development. Becoming a senior and fellow was really instrumental to me because it kind of forced me to get involved, kind of forced me to learn more, to speak, to write, all those sort of things. And that in turn helped me in my career, and most importantly, the organizations in which I serve. So I love HIMSS. Thank you for having me. It's really a thrill. We do have the ability to take questions as we go along. You know, sometimes you hear someone go on and on and on, and you wait to the end for questions, and then it just doesn't seem like the timing's right anymore. So you can go ahead and use the chat function, and those questions will get to me. So I won't be too distracted looking out for those. So if I say something and require clarification, or you want to go a little deeper, just use the chat function along the way. We'll still have time for questions at the end, kind of a traditional way of doing it, but we can also take them on the way. It's just more interactive, and I'm good with it. So I do have about 20, to tell you right up front, about 25 slides. I try to keep my slides somewhat minimal and mostly tell stories around the slides. I'll try not to read slides to you. We'll make the slides available to you as well in case there's something you missed that is of interest to you. But really, I think it's more around the sort of commentary around the concepts on the slides. So as you know, it's healthcare digital transformation. It is based on the book that was referenced. So you can find it if you're interested in it in a multiple ways. So that's all I'll say about the book. But if you like what you hear, you want to go deeper, a lot of the content plus more is in that book. So you probably subscribed to the webinar because you saw what the learning objectives were. So I thought we would review those really quick, and you can hold me accountable and make sure that by the end of our time together, I've touched at least on parts of all of these. So again, I won't read to you the slides, they're right there. So with that, let's jump in. The first thing I like to do is really define digital. And some of you may have seen me speak. I spoke at a Minnesota conference last week that the chapter was part of. So about 5 of the 25 slides will be similar, but I'll have a little bit more time this time to speak to those things. So one thing you have to do is define what is digital. And here's the bottom line. You just define it whatever works for your organization, because there's no way everyone's going to agree on what digital is. So if you Google it or Bing it, you'll find thousands of different interpretations. What I always say is you do need to figure out what it means for your organization, and everyone in the organization needs to land at the same spot. So do take your time figuring out a definition for your organization. So here's the HIMSS definition, rather lengthy. I'm more into short words that I can remember. So my definition is below that. It's about improved experiences powered by tech, enabled by design. I'm really big into design, so you'll hear and see more of that as the presentation goes along. I think it's less about tech, and it's all about the experience, and how do you get to the experience is good design. So we talk about digital transformation like it's something new, but it's been around a long time. And so let me tell a quick personal story about my first exposure to digital transformation and the catalyst for me to get involved in healthcare technology. So a long, long time ago, we were expecting the birth of our first daughter. This would have been 1993. And I worked in marketing. So I started in the OR as an anesthesia tech. I got along well with the surgeons. So I got hired in marketing and strategy to do physician relations. IT had come to me about, I think it was 1992. They came and said, look, Ed, we've got this great application. And it's got this module where clinicians can dial in. Back then it was like via modem. They can dial into the software and see everything in real time. So if they're at home, they could dial in and see, results, see what's going on with their patients, those sorts of things. But they only had 5% adoption. So I had pretty decent relationships with the docs and their staffs. So I got involved, learned about IT, learned about this product specifically, that they had this dialing capability. And as a result, they went from 5% to 95% adoption, not because any magic that I had, but just some existing relationships and just leveraging them through good marketing. So our daughter is born September 4th around 12:30 a.m. And it's a very, very traumatic birth. She's born floppy, which means without life. For about 6 minutes, they had no vitals on her as they tried desperately and all sorts of means to try to get her out of my wife's womb. And they finally managed to do that. But she was immediately whisked away so they could try to resuscitate her. And they did, but she still had 3 life-threatening conditions. Back then, the biggest killer of newborns was strep B. Now, today, we're smarter about it, so no one really has that anymore. But back then, we weren't so smart. Then she had pneumonia and a hole in her stomach and insides just from all the trauma. So they did resuscitate her, and then they were like, Ed, it doesn't look good. We probably should life flight her to a children's hospital where they have, level 3 NICU and neonatologists. And but my wife was also hospitalized, and so to life flight our child away so far away, and then being disconnected that way, it was really difficult decision to make. And so we decided that it probably wouldn't be good to separate, but we still wanted her to have this great care. And then I realized, wait a second, we have this great product that the IT shop has where clinicians can dial in. So why don't we send a technician, because back in the day, that's the way you had to do it with these modems, and you had to load up software. Why don't we send a technician down to Denver Children's Hospital where they could do this? So we were in Fort Collins, about an hour's drive north. And so that's what we did. So we dispatched someone, and within a couple hours, the neonatologists were on the phone talking directly to the clinicians in our level 1 NICU, and they could see all the results in real time and things that were going on with our baby. And sure enough, just through great medicine, through digital transformation, through digital health, virtual care, whatever buzzword you want to use, our daughter was healed, and my wife was as well. So we came back. This was when my daughter Tally was 18. We came back to that same NICU just to revisit and check it out. And then one of the nurses that was there was actually remembered her. It was quite a fantastic reunion. But that, to me, digital transformation has been around a long time. It's a new buzzword. But it's really important that whatever the wording is, if it takes a buzzword to catalyze the organization or catalyze healthcare to do something better, I'm all about it. So I've glommed on, as my daughter would say, glommed on to digital transformation, and I'm running with it, because whatever we can do to leverage technology to save people's lives is what really matters. So that's what I think about it. So let's talk about the forces today. And I'm going to give you real examples in your neck of the woods too, where there really is a big shift going on, and it's in 6 or 7 different areas. And if we don't take hold of these or take these seriously, we will be disintermediated. I'm a very optimistic person, but I know I do come across as a doomsayer for provider side, partly because I don't think many providers understand what's happening yet, despite all the evidence. I'm going to give you evidence that came out as late as yesterday about what I'm talking about. So first, you have consumerism. So consumers are demanding much more. I think we could all give examples, and I won't waste any time because I think we all have them, of how other industries treat us way better, know us way better than healthcare does. Just one quick example, because I thought it was so hilarious, is on Twitter earlier this summer. I was like talking about this, like, who knows me? And I tagged my bank, I tagged my airline that I travel most frequently, and I tagged my healthcare organization. And I was like, who knows me? And my bank responded, and then they responded privately with something personal. My airline responded, and then something personal. But my healthcare provider never did, because they don't know me. I'm just another of a million patients that they have. But consumers are demanding more. And so, the examples that you all would have, whether it's your veterinarian, how they treat your pet, or your vehicle servicing, like I took my Jeep in for servicing recently. It was this amazing digital experience. So we don't have the same thing yet, and consumers are demanding it. So the other thing is payers, right? The payers, and that's the example I'm going to give you here in a second. The payers have become so strong. They were always been strong, and they already had the largest primary care base. I don't know if people realize that. They have more primary care physicians than providers do. And when I say providers, I'm talking about traditional healthcare that we all probably come from or think about, or the majority of us do, hospitals and clinics. And they made quite a bit of money during the pandemic. So while providers didn't do so well for obvious reasons, payers did really well for the opposite reasons. So people weren't doing elective surgeries, so there was less payments going out. So if you thought they had a war chest before COVID, they have a huge war chest today. So there's digital first medical that's out there in a bold move. They're advertising in places you would think they would go to last, like in Cleveland, and challenging some really strong global brands out of there. And so these are healthcare providers that are strictly virtual. There's no brick and mortar whatsoever, and they're very, very convenient and very engaging and all about the experience. I talked about pandemic financials already. Then you have neighborhood retail. So I don't know about you, but down the street, within a couple of miles, I have a CVS, I have a Walgreens, and the CVS store is one of the first to convert. And they flip their square footage. I'm rounding up a little bit here, but instead of 70 to 30%, 70% retail, 30% healthcare, they're flipping it. 70% primary care, 30% retail. So they are directly competing with provider side. And then you have pharma as well. And so pharma is also getting more active. They want to make sure their patients are taking the medicines. There's medication adherence. They're getting much more into the consumer, and everyone is really vying for the patient or the consumer awareness, the consumer, I hate to use the word ownership, but that's some of the wording that they would use in their strategies. It's like whoever owns that relationship is going to be the big winner. So you can see that today we're dealing with a lot of new entrants, and of course, big tech is getting engaged as well. We haven't seen quite such blatant encroachment, but it's coming. And so you've got all these forces going around. So it really is survival of the digitalist, and that's one of the reasons I'm really passionate about this topic. Is I'm a huge believer in the providers. I believe that healthcare given by providers who are doing this because they care about their neighborhoods and communities and the local aspects of what they do in their mission are the best ways to move forward. So I just want to share everything that we see out there, I see out there, that it might be helpful in developing better strategies. So let's talk United Health Group. This was yesterday. None of this is a secret. You can go to Aetna, CVS, you can go to any of their websites or listen to any of their marketing, and you will find these examples. And again, it's not hidden. That's why sometimes I get a negative response to some of the things that I'm talking about, like it's heresy, but it really isn't. It's really out there. These are real examples. So the CEO was talking about their 5 growth pillars. One is they're going to reinvent healthcare delivery. Who's delivering healthcare today? Now, of course, I'm speaking in generalities, but it's the providers. And again, when I say providers, it's most of us here, the hospitals and clinics and so forth. So they're going to reinvent healthcare delivery via high-performing local medical practices. I already shared with you that there's more primary care in the payer community, and then there's provider side. And remember, who drives where the patient goes to if they need specialty care? Primary care. So they're completely disintermediating everything that we know. And I'm not saying it's good or bad. I'm just saying it's changing, and you need to be aware of it so you can make appropriate adjustments to your strategy. So they are doing digital clinical homes, the virtual pharmacy, house calls for seniors, digital pharmacy, everything powered by very strong AI capabilities. So they have capabilities, and again, because of the money that they have, partially, to do things in a much bigger, more in-depth way than many of the providers can. Growth pillar number 2 is pharmacy services, including direct to consumers. So if you think about PillPack and the Amazon acquisition of PillPack a couple of years ago, they're doing their own daily dose packaging, their own home infusion, developing their own stores, and so forth. So they are getting into pharmacy. And I know for some healthcare organizations, specialty pharmacy is one way that you're making up for shortfalls in revenue in a different area. So they're really encroaching on all of the sort of blue chip commodity type things that keep many of the provider organizations afloat. The third thing is consumer-centered benefits. So they're giving many choices, digital therapeutics, very much into wellness. So again, they're taking control of that patient engagement, the patient, and again, I apologize for the word, but it's the word they use, the patient ownership. So they're taking that away from where it used to be on the provider side. So you listen to whatever the provider told you, and you would utilize their hospitals should you ever need hospital services. And it was really sort of an end-to-end solution in that example. But now that front end is being taken away. So just think about the implications. Growth pillar number 4 involves analytic-driven insights. So again, this is directly from the CEO. They're spending big dollars in business intelligence, AI, machine learning, and making huge investments and bets in startups. So they're really doing a lot to engage consumers, to enhance the experience of consumers, all the things I talked about on the previous slide when it came to consumerism. And then health finance tech, or fintech as it's often called. So this is to digitize the whole payment structure, right? It is so convoluted, that between the payers and the providers and the government, and it's very manual intensive, lots of labor costs. And so they are going to really change all that and also reward consumers or reward patients and clinicians financially for being healthy. So complete game-changing ideas. And again, they've got the money behind it. Some of these concepts we've talked about for years, but they actually have the money to do it. And they're already doing it. And this is just one example. That's what I'm trying to share and make sure you understand. This is not just Ed's thinking, about what might be happening. No, this is really happening. And it's very obvious that it's happening. So we really got to take hold of it. All right, so that's enough sort of about why it's survival of the digitalist. So what are some things that you can do? One thing I said I would do is share sort of a format or platform for a strategy. So you really need to have a digital strategy. Now, only about 25 to 35% of provider organizations have an IT strategy. It's so hard for me to believe, but I can tell you I've taught boot camp for CIOs or aspiring CIOs for almost 10 years. This is through a professional organization called Chime. We do 2 sessions a year. So I would be exposed to about 120 different organizations a year. And I can tell you that only about 25%, I say up to 35%, just on the positive side, have an IT plan. So out of those, how many have a digital transformation plan? I would say much less. Now, because of the pandemic, I think people realize the importance of having a plan. So I think there's more efforts going on now. So it's like the definition of digital. It really doesn't matter what your plan looks like as long as you have one and everyone's bought into it. I'm going to talk about how to do that in a second, but I'm really big into one slide presentations. And so we were actually, where I came from, we were actually encouraged to keep everything to one slide. So if someone said, what is your strategy for digital transformation? Here's my one slide. Now, of course, I could go deeper. I could double click under all those 10 different subsections like culture and infrastructure. I could double click and that would open up some more, actually just one more slide. And then I could go a third level deeper, maybe for some internal IT customers. So that's the important thing though, is just have a plan. This is what works for me. There's better ones, I'm sure. But the key concept here is it's around the experience, the human-centered design. Because I think we all know you could have great policies and procedures and governance and all that kind of stuff. If it's not usable, if it's not adoptable, it's going to fail. So that's why everything I do, I try to think around human-centered design and the experience. So you can, again, you can read everything here. But one thing that's often overlooked is culture, which will kill you every time. So really pay attention to culture. These aren't necessarily in rank order, but I did put culture first for a specific reason because of its importance. So then, what are the personas? And again, similar answer, because there's no cookie cutter. I know every provider is a little bit different. So I just try to give you some generalities. So what are some personas that you really need to think about? So it'll be different for every organization. For my organization, it came down to 7 different personas. So the important thing, again, you'll agree on what they are and you have defined strategies for each of them because each of them are different. So obviously you have patients, and then when I say caregivers, these are individuals who take care of patients. So these family, but it might be for you, depending on the brand of the organization, it might be the organization, it might be the community, it might be the brand itself. Maybe it's regional brand or a national brand or a global brand, those sorts of things. But you really need to identify the persona. Sometimes hospitals, health systems providers have multiple personas just on patients, and that's valid too. Like I said, there's no right or wrong answer. It's just you need to define it, and that will really help greatly in your ability to digitally transform. So I'm going to shift now. So I sort of gave like sort of the big picture, survival of digitalists, what's going on. We talked about what is digital transformation. We talked about a model for digital transformation. We talked about the personas. Now we want to jump into a strategy. So let's assume you're one of the 80% that doesn't have a digital strategy. You can do this yourself. Now you can leverage, and there's often good reasons to leverage external assistance, consultants or so forth for strategy. Definitely something that's reasonable. I've done that before. But you can also do it yourself. So the plan I'm going to show you could be with do it by yourself or bringing in someone else. So this is actually the strategy I employed at the Cleveland Clinic when I had responsibility for not just the CIO, but for digital strategy. We did it ourselves in 8 weeks. And then with the adjustments that we made after our final presentation, I'm going to call it 12 weeks. And I did it I hired one person to sort of be a project director. So overall, who understood digital, was able to provide the structure. I just didn't have time to give to it. And nor did I feel like I had anyone internally at the time who had time and also had a good understanding of digital that they would be able to program direct it. So one person, but basically we did it all by ourselves. So let's go through those 5 steps. And again, there's nothing magic about me. So if I can do this, I always say I'm probably pretty average. I've been fortunate to work in above average organizations, but I'm probably pretty average. And so if I can do what I'm about to share with you, you can do it as well in your organization. So it's really quite simple. 5 easy steps. One is I would start with vision, and it may just be you at first, but I would craft a vision because it's hard to get followers if you don't have a vision. So now the vision's going to change, but you got to start with something. So go out there, make a bold statement about the future and for your organization. What is the vision? And see if that inspires anyone to follow you. So that's a really good litmus test. So, hey, is there anyone following you? Now, if your organization doesn't have a digital leader, then you should become that digital leader and ask how you can help. If your organization has a digital leader, you should ask them how you can help them. So there's a lot of different ways. Don't ever say that because of your position, you can't do any of this or you can't suggest any of this. I would tell you that part of my maturity and growth and leadership was just taking a lot of risks and just volunteering and asking and encouraging and learning as I went along, and then learning from those individuals that said, okay, yeah, we'll give this guy a shot. So create vision. If there's nothing there in your organization, make it happen. If there's something there, complement it. Just get involved. So create the vision. Let's start with that. Establish a team. So you create a vision, you get a lot of passion, you got a lot of energy. So you got to get the right team, because if you do it yourself, you'll fail, right? So I talked about how you can start it yourself and you could develop a digital strategy, but you're just the catalyst or the orchestrate, or the leader of the orchestra. You can't really do it yourself. You have to have the right team. But now that you have a vision, some people are interested, they want to help you. So that's when you go to your organization. So the reason I divided up into these 5 sections that you see, like patients and clinical caregivers and caregivers, is that's the way that we were organized strategically as an organization. So leverage your organization's foundations. Don't try to create something new unless nothing exists, and you'll have a lot more success. So it's really easy. Hey, these were the 5 things that our organization's about. So I'm going to align the digital strategy with those 5 things. Makes a lot of sense, right? So that's what we did. So I got the influencers as well as the formal leaders engaged. So I made sure we had good clinical representation. I made sure we had good finance representation and HR representation and marketing and biomed and supply chain. You wouldn't know these names necessarily, but those are the areas they covered, pretty much the whole breadth and depth of any organization. And we're a complicated organization. So they all had their own little committees underneath them. So for the patients, the leaders for the patients, they had actual patients being part of the team. So that's a really important thing to do. So this was my DigX, I call them, I don't just made it up, Digital X team, were these individuals. And whenever we presented, I rarely presented. It was one of these members that presented. So while I was happy to coordinate and orchestrate, I just felt it would be best coming from clinicians or other key stakeholders than myself. The one other team that I had created was a very large stakeholder group of about 100. Now it depends on your organization, how big it should be. But these were individuals that had extreme influence. But so let's just say they weren't one of the main ones that you see here. They may have been part of their subcommittees that I alluded to. But I brought them together, and I don't want to waste a lot of management time, leadership time in meetings. So we just brought them together probably in a 12-week period, probably 4 times for 1 hour. And then, the CEO kicked us off the first time, showing his involvement and his blessing on the process, and really gave them a chance to engage. And they did pretty much all engage. And I included in that 100, I included strategic partners and patients. So we had patients in the room, we had strategic partners, which would be vendors that are strategic to you, plus the influentials of the organization. And remember, a lot of times the influential individuals in an organization do not have a formal leadership role. So really key to remember. All right, so you establish team of teams, and then you vet the vision and you go back and forth. So you might update the vision at this point so they own it. And it's beyond just you. So before I move on to the next key, I said there's 5 keys to developing, or 5 steps to developing strategy. We have a couple questions, and I'll go ahead and take a look at those. It's really, both of them are around culture and change management. So yeah, it goes back to what I was saying, where, what's the popular saying? Culture eats strategy for lunch every day. It's really true. So I was very fortunate. My first CIO, big time CIO position was at University Hospitals. I was very young and unqualified. I was very fortunate that the CEO gave me a shot, and he came from Cedars-Sinai. Now, many of you won't remember this because it's an old story, but in Cedars-Sinai back, let's see, this would have been, let's see how fast I could think on my feet here. This would have been early 2000s. They did everything perfect for an install of electronic health record. Everything was perfect, and it busted to the point that they uninstalled it. They stopped it. And it was because of 2 physicians. And so my CEO was the COO of Cedars-Sinai. So when he came to University Hospitals, he reminded me often, because we were going into our own EHR journey, he reminded me often about culture. So the reason for that team of 100, I was getting at culture. I was making sure that all the naysayers had a voice. Do not avoid naysayers. Make sure they have a voice. And so that was really one of the hidden reasons I had that 100-person group. And also, you may have a naysayer that you want to put on your DigX. So remember, DigX was sort of my direct core team that helped me shape the whole digital strategy. You may have a naysayer there on purpose. So if you can win over the naysayers, or at least listen to them and be able to compartmentalize them, if you never win them over, that's what I'm talking about, culture. Change management is similar. In order to have adoption stick, you have to make sure that you have all the support mechanisms in place. And that comes through you need to let people talk. You need to let them have avenues for sharing their minds, sharing their thoughts. And that's what we did. We over communicated. We constantly communicated via video and other means, constantly communicated. The other thing I did, and some of these examples I just give to you to be practical. I'm not saying these to say, hey, wow, look at Ed, what he did. No, I'm just sharing because some of these might resonate with some of you. I volunteered once a week in the cancer hospital. So I sat with cancer patients. Anyone can do this. They were coming in for their outpatient chemo. Half or more were alone. So my job was to bring them blankets and pillows and coffee and cookies and sodas, whatever they wanted. Most of them just wanted someone to talk to. You can do that. When you do that, you hear the patient's needs around digital. You hear the staff's needs around digital. The other thing I did, remember I share with you as a combat medic first, and so I worked in the OR early in my healthcare career. And so I was able to get a clinical appointment where I came from, working in the OR. So I took like the 5 a.m. shift on Wednesdays, working as an anesthesia tech at the Cleveland Clinic. And again, that was really an eye opener and always learning things. So you learn about, okay, how is this change being handled? What are some of the obstacles I need to address, and those sort of things. When we think about vision in terms of a timeline, this is another question that came in because I talked about vision. When I think about it, we all know that vision in the digital age, is about 6 months. And we all know the quotes from a variety of people, whether it's Mike Tyson talking about boxing or General Patton talking about war. Plans are really good and important, but they change, the moment you get punched in the face or the moment the first bullet is fired. That is all true. That's why plans need to be agile. I'm going to talk quite a bit about agile, but you still need a plan and a vision. And I think 3 to 5 year chunks are doable. Obviously, you keep revisiting them and making adjustments. But when I think about vision, especially for digital, it takes a while to get some of these things up and running. So I think a 3-year window is good. Some organizations, even recently, I'm trying to remember who it was, came out with like a 10-year vision. I think it might have been Mayo, actually, which is pretty bodacious, but I can guarantee you that they're revisiting it on a frequent basis and making adjustments. So the other thing you do is you get multiple inputs, right? So you've got the vision, you got the team, you reiterated on the vision, and so now you get multiple inputs. And I'll need to go a little bit faster here to get through a couple more slides. So do research, right? Anyone can do this. Research, you can have one of the teams do it. Then you present it, and then you use it to feed into your plan. Then you want to leverage experience of other health systems. So that's what I did. I went to we were in the top 10 U.S. News and World Report. So who did I go to? I went to the top 10. And most people are really nice. And you notice at the Minnesota chapter, Minnesota's a great state, great organizations. You can all call each other and find things out, or call someone across the country. So that's what I did. And then I'd share with them, hey, we're thinking about these 3 things. What do you think? And they would tell me and help formulate my plan. We engaged think tanks, best practices. So you can look up these things. Gartner, I hate throwing out names, but Gartner is a good example. Forrester. You can also, what I did is I went to some of the big firms, the consulting firms, and I'd say, hey, you guys give me a couple hours, look at my plan. They were dying to look at my plan. And then I got good feedback and information from them. So when we presented the strategy, And we showed this slide actually as like this, but we listed everyone we talked to. So when I say leverage health systems, I listed the top 10 health systems, right? So then everyone goes, oh, okay, this must be a decent plan because they check things out. Hey, we engage with Accenture or whoever, and they were like, oh, credibility. Then we collaborated with partners. So we went to our EHR vendor that we consider a strategic partner. We went to maybe a technology vendor that we considered a partner, and we learned from them, right? They've got a good view across the globe. We learned a lot from them. We did a survey internally, so you can use SurveyMonkey. So everything I'm sharing with you is free. It doesn't cost any money to go talk to a consulting firm and present to them. It doesn't take any money to do any of these things. And then you take all this stuff and you ideate. So with that group of 100, you try to get input, but definitely the smaller committees, and then my digital X, and we just ideate and go back and forth through an iterative process, agile process. So it's time intensive, but only for 8 weeks. And then like I said, 8 to 12 was just finesse. All right, so you've done a lot of ideation, a lot of research. You might change the vision again. You don't have to finalize on the vision until sort of the end. You got to get organizational alignment and buy-in. We talked about this with change management. So I already explained to you many methods on which to do that. Over communicate in a variety of ways. The other way I communicated was I would do, so we're big, just like I've been up to Mayo campus, because of the weather, you have a lot of hallways that are connected, and so you can walk for a long time and everyone's trying to get their steps in. So I would do steps with Ed at 6 a.m. So this worked good for clinicians. And then you could do, and I know I probably get in trouble for this, but it was like drinks with Ed. So we had a place where people went after hours to just chill and hang out sometimes. And so it's like, hey, I'll buy you a glass of wine. You want to talk about something related to digital transformation? Look, it worked. I did everything I could to get people's voices work in the OR, volunteering, whatever you need to do. And again, not just me, but my whole DigX was doing something similar. So we're really getting out there and then building the confidence, right? That's why step 3 about all the things that we did, all the inputs, really built confidence in the organization. This is not just one person's thinking or a group of 10 people's thinking, but this is like really well researched and thought out. And then finally, resource for duration. A lot of people get caught up here because they come up with a great plan, but finance isn't behind it, or they haven't thought through the financials. So you got to include the financials. And part of my DigX team was a member of finance. In fact, I may have had 2. But obviously I kept my CFO closely informed and then really tried to challenge them in terms of, ways of funding digital that's different than way of funding IT. So those are the 5 steps. And then you got to execute. So it's pretty simple, right? You can literally do this yourself, get help if you need it, 8 to 12 weeks, build the vision, get the team, get the inputs, get the organizational buy-in, and then resource it accordingly. And then it's a matter of execution. So again, I won't read to you a slide, but you got to be able to execute well. So hopefully you've done a lot within IT already. Not that it all falls on IT, but certainly IT is going to carry a heavy lift, and you need to make sure that you're able to execute. So a little bit about experience and design. So I'll spend a little bit of time on this because I want you to catch this, because it's one of my main themes here, is that if you do the things the same old way, it's not going to work. That's why we're behind. You got to learn what the best practices are from outside of healthcare. And so I'm very fortunate in my role today. I knew this before, but I'm learning even more today. One of my sisters, I'll call them, is #1 in the world for marketing, advertising, creative content, and commerce. Like we do Starbucks, we do Sour Patch Kids, we do Google, we do just about any brand you can think of, we're behind it, the whole engagement experience. So now I'm learning a lot more and leveraging that. But this is basically the formula, if you will. It's what is customer experience, it's the brand, the behavior, and the book of record. And I'm simplifying, and I'm just got one more slide on this concept. But if it's of interest to you, you could Google this and dive more into it. But you really got to understand this whole experience engagement. That's why patient portals, I know I'm getting in trouble for this. A lot of patient portals have very low adoption. And why is that? Well, there's a lot of reasons, but I think a lot of it has to do with engagement. They're just not as engaging as a Starbucks app. Now there's exceptions, and a lot of people are building their own things on top of it. But I think generally that's probably why. And I'm not picking on anyone specifically, I'm just speaking in generalities. So what is the book of record, behavioral experience, brand experience, those sort of things? So your book of record is like your CRM system, customer relationship management, which only about 10% of healthcare organizations have, but definitely your EHR, your ERP, that's kind of the book of record. And then how do they experience you, you know, through web, through mobile, through IoT, just different channels. And then how do they get that experience? You curate it through advocacy, through discovery. You can read all those things there, but that's really how it all comes together to make for a human-centered experience, because in the end of the day, experience is your brand. So no matter what your marketing might say, it's really the experience is the brand. So I went through that really quick, but really foundational. So we have about 10 minutes left. If you have any more questions, feel free to add them on. I'm going to try to leave some time at the end. I think I just have a couple more slides. Digital maturity, this is a good self-evaluation, like a SWOT that you might do on yourself, your organization. This, I believe I got this from HIMSS. And the important thing is, I don't care what model you use. There's a different one in our book. It really doesn't matter. Just pick a model. HIMSS does have a new model, a self-assessment that you can use, which I would recommend. But the important thing is just be gut honest and say, where are you today? Where do you want to be tomorrow? So let's just say it's a 3-year plan, 3-year vision. Just be really honest and say, okay, and have other people rate you, because you'll probably have some inherent bias like I did. But just say, where are you today? Where are you tomorrow? So then what's the gap? And then you can build in that strategy, the specific piece of the strategy to fill the gap. Pretty simple, but yet people don't do enough of that. It's rather amazing. So here's a model you can use. It's pretty self-explanatory. Again, in the last 6 months, HIMSS has come out with an even better model, self-evaluation, and I would recommend doing that. So I'm a big believer in Agile, not just in like how you develop things, and I know not all hospitals develop their own software and things like that, but I'm talking about the way that you work, so the way that you're organized. So most modern companies that you think of today, like digital companies like a Facebook or a Spotify, they all run Agile. So they're organized much different than a traditional hierarchy, which comes from the days of the pharaohs, actually. And so think about new ways of organizing IT to be much more agile. And so that's what we did. So that was the first thing I did as part of our digital transformation, is we became agile. So it was a whole new way of working. We completely reformed. There was no stick, what do they call the hierarchies, you know, the stick diagrams, but it was more team-based, and it's completely different. So if you want to know more about Agile, you can look that up as well. But it really is a different way of leading. It takes a while. It took a good year, and they're probably still working on maturing. It probably takes 3 years, I'm going to say. But it probably takes a year to get the foundations done. So I would start right away and get moving in an Agile way. The customer satisfaction goes way up because you're communicating a lot more, you're failing a lot faster, you're making decisions faster. It's just a whole new way of work. So a little bit about Agile there, and you can read the slides yourself. All right, so a lot of people have formulated their digital strategy. This is what a lot of people say, my digital strategy is whatever my EHR is doing. Okay, all right, I'm not gonna say anything negative about that. But you might wanna do more than that if you were convinced at all by my second or third slide where I showed you what United Health Group is doing. You rely on your electronic health record, and I don't think you'll have a chance against United Health Group. So that's what I'm trying to share is you can do status quo, but if you want to do more, you got to really pick up the game for your organization. So looking beyond COVID, obviously it accelerated the timelines. The digital, some of this is obvious, but when we talked about culture change management and talking about organizational buy-in, the more you develop the strategy to complement the strategic plan of your organization, the better, right? You don't want to be out there thinking that you're doing something completely different. You want to align. You have to, I already said it once with the Agile example, you have to transform IT, and you really have to think enterprise. So it's going to require very robust governance that you've not had before. A lot of people talk about governance, but it never seems to work well. That's why we keep talking about it. So let's go to ensuring strong foundations. You'll see a couple of things repeated, not directly repeated, but some themes. Those would be things that I would really pay attention to. Obviously, you got to transform IT, and that includes your infrastructure. So I don't ignore infrastructure, but you got to build it at the same time. You can't wait. You can't say, oh, I need $1 gazillion to move to the cloud or do my infrastructure, and then we'll do digital transformation. No, you have to do both at the same time. And that's what we did. So we couldn't wait to fix our infrastructure and data center and all that kind of stuff. We had to do everything at the same time, and you can do it. And it's related to a question here, is how to allocate resources and how to get money for funding this. When I talked about that fifth step, ensuring the appropriate resources, what you can do is you can digitally transform your IT, take half the savings of that and plow it into digital transformation. Now, I know a lot of people will say, yeah, Ed, I've already pulled out all the money from IT. Okay, maybe you have. So I used to say that a lot too. My organization would still bring in, some other organization, and we always found more dollars to pull out. I've done this a couple times now, and I really believe, and I don't have time to go in examples, but I've seen it work more firsthand now because I'm actually on a sort of a global, I'm with a different company now. I'm not on a provider, specifically like a hospital, and I've seen it done for organizations. So I know it works, where you might be able to find 25, 30% cost savings. And the deal that you make is, look, I'm bringing it on my own, and they'll report to a broader constituent. That always helps when you say to the CFO and the COO or whoever you're talking to, the CEO, hey, I'm gonna bring in this company on my own, but they're gonna report out to all of us. So that ensures transparency and accountability and good stewardship. And whatever savings we can get out, can we plow back 50%? I've never heard anyone say no. So that's one way of allocating resources and making sure you get money to do digital transformation. And I'm a big believer in making sure that the organization understands to fund this, it requires a percentage of operating every year. So it's a multi-year commitment, like in perpetuity, of a certain percentage. Most organizations already do this on the maintenance and facility side of the house. They have an aging, the physical plant over time needs reinvestment, and you don't want to wait till you have to replace a building. So they usually allocate a percentage to refurbish the physical plant. You need to do the same for digital. And it's a new way of thinking, but that's what you got to fight for. So you have to transform, and you can use a lot of different things like ITSM or technology business management, but you really need to get your own house in order. That's really the point here. Get your house in order. It'll give you more credibility to do digital transformation. So a couple last slides. Yeah, I'll just end with this, and then we'll have time for questions and answers. And I'll just tell you another reason I'm really passionate about this and why I really try to kind of stoke the fire of people to really get engaged and take hold of this. And if your organization is not doing it, for you to get involved and encourage others to take hold of it and use whatever good means necessary to really serve as a catalyst to bring digital transformation to your organization. So 2018, I do some sports, as Tariq mentioned early on. I was at the 2018 National Championship. So I am on Team USA, and every year you have to re-up, which is kind of cool, right? You can't rest on your laurels. You always have to be on top of your game. So I always have really good physicals, right? I came from a really good organization. I do these executive physicals every year, and they were like, Ed, you're in the top, 1% or whatever of your age group for health. There's nothing wrong with you, yada, yada, yada. And if you looked at my athletic performance, you would agree. And so I entered the 2018 National Championships like I did any other year. And I'm running in the last 2 miles of the race. So it's a duathlon. So it was like run, bike, run. I'm in Greenville, South Carolina. I can perfectly visualize as I'm telling you this story. 2 miles left to go. And my chest, I feel tremendous pressure on my chest. And I'm thinking to myself, hey, this is how they describe heart attacks, but I can't have a heart attack because, I just had my physical and they said I'm in the top 1%. Plus, I eat right, I exercise, I have no family history, so I'm not having a heart attack, and my left arm doesn't hurt, my jaw doesn't hurt. So I can't be having a heart attack, but yeah, actually, I think I am. So I started to slow down a little bit. I was still running actually really fast, and I started to slow down, and a teammate passed me up that normally doesn't pass me up, and he's like, follow me, follow me. And so I tried to keep pace with him. I couldn't, and I was like, I think I'm having a heart attack. And so I was like, okay, if I stop now, I knew door to balloon time was really critical. I was like, if I stop now, if you've ever been to any of these races, there's huge races and all the traffic's blocked off and there's all these barricades. And I knew that there's a medical tent by Bon Secures at the finish line, and the ambulances are there. So by the time they get to me, you know, the race officials, you know, and then it just seemed like it's going to take too long. So I thought, hey, I can still run. I probably shouldn't run, but partly my pride or my arrogance, I don't know what it was, maybe a combination of things. I just decided to outrun the dang thing. So that's what I did. I kept running and running, and so this is me at the finish line. I even passed someone that's from the race previous to this. So I passed this person. I check into the medical tent. I said, hey, I think I'm having a heart attack. Now, the things that I'm most passionate about, digital health, I carry with me and I have with me. And so I have this little credit card size EKG machine, basically. And so I'm like, hey, I checked, I said that, I checked in the medical tent. I said, I think I'm having a heart attack. We got out the EKG, we Bluetoothed it to my phone. We did the reading, we sent it to the hospital nearby, that's the emergency hospital for the race. And they're like, yep, he's having an LAD, the worst. It's called a widowmaker. It's like the worst of the heart attacks you can have. And so I had to be transported. So I get transported, and then meanwhile, they're doing more EKGs. And then when I get there, the interventionist cardiologist, he's like, hey, I'm really sorry that this happened to you, but I'm going to take really good care of you. And I was just talking to Dr. Neeson at the clinic, and he's like the world's foremost interventionist cardiologist, a friend of mine. They had already been sharing images. So it was the digital technology that saved my life. They were sharing images in the cloud, but while I was being transported for 10 minutes in an ambulance, they had already done my treatment protocols. So then it was like, okay, let's, I don't even know if they gave me medicine, or, you know, they probably did give me something, I don't even remember, but I went in there because it didn't hurt. And it's just this pressure. And they went in there and I watched, he brought an extra screen for me, and I watched and I saw my heart, only 25% of my heart was actually working. The other 75% didn't have any blood flow, and it was just like a glob. And all of a sudden I see him stick through the cath, you know, and all of a sudden the heart just starts beating, and the pressure went away, and I felt fine, like I could race again. So it saved my life. And my door to balloon time was probably like 30 minutes. And so I was like, okay, when can I, and I made the team. And I was like, hey, when can I race again? So I got to sleep with my nurse. That's actually my wife is a nurse. So I was fine, but I stayed in bed, you know, because that's what the protocol is. But I was like, look, I've got to get back to, I got a world champion. I just made the team. I got a world championships in 90 days. Oh, here's what I'm talking about. So this cardia, this was my stuff. So I was like, okay, I got to get back. And my doctor was like, hey, Ed, you'll be lucky if you can walk that far in 90 days. You're not going to be going to the world championships. I said, no, let's use digital technology. So I talked him into, he was kind of an old school guy, but great guy. And he's a new school guy. So I talked to him, the same watch I'm wearing right now. So I use this watch, I use the cardia, I use the Bluetooth blood pressure, I use this patch. And so they allowed me, based on results every day, they adjusted my meds. Usually you don't get your meds adjusted until you get your 6-week follow-up. I was getting daily adjustments in the beginning. And then they would allow me to run faster, or like let my heart rate get faster and faster. And so at the end of 90 days, it was exactly 90 days. So the episode was April 7th, 2018, and this is July 7th, 2018, 90 days to the day I'm crossing the finish line at the World Championships, representing Team USA. I don't share that story to say, oh, look at Ed. No. It's a very humbling story, actually. And I share it with you because what we do matters. What all of us do, I don't care if you're a manager or an analyst or a director or a CIO, what you do matters and makes a life in the difference of people. And I got to experience it firsthand more than once. And I got saved by digital technology. And certainly after I got saved, it helped improve the quality of my life to where I'm racing again and I'm as fast or faster than I was 2 years ago. And it's because of this digital transformation. And you and I have a key part in it. So you can't say, I'm just an analyst or manager. That's not what my boss wants me to do. Or no. We all have, I believe, a moral obligation because we know the power of the technology with the clinical care, with all the business aspects. We know what a difference it can make in people's lives. And so therefore, it's incumbent upon you and incumbent upon me to take action, to get passionate, to get energized, to get other people energized, and to make change in our communities and our hospitals. Because if you don't do it, who's going to do it? Seriously, if I wasn't pushing it, I don't know who is going to push it. And if you're not pushing it, I don't know who's going to push it. So we all need to take hold of this and realize how critical each one of us are. Again, I don't care if you're an analyst or manager, director, CIO, you are all important and critical to this process. I'm going to stop speaking now, and we can take more questions. I don't know if that's limited to chat. And I know our time's up as well. So I'm going to turn it back to Rebecca.
Thank you, Ed, so much for sharing your both personal and professional stories. You have addressed all of the questions that came in, so that is really great. So thank you for taking the time to present to our members. Thank you, Bahama Consulting, for supporting our webinar, and thank you to all of our members that were able to attend today. Thanks for the time. Again, please look at our website at mn.himschapter.org to learn more about future webinar events with our chapter. Thank you, everyone.
Thank you.